My name is Apurv Soni. I'm in the Clinical and Population Health Research program. I finished my dissertation last year, and so right now I'm in my 4th year of medical school. And so total in the MD PhD program for I think a grand 9 years. I was born in India, and I moved to America when I was a sophomore in high school. My parents live in Lowell, Massachusetts. That's where I finished my high school. My PhD project was on child undernutrition in India, and I looked at the trends of child undernutrition over the last 2 decades. How can we predict child undernutrition at the time of delivery, and what are the consequences of child undernutrition? So it was kind of a 3-aim project that tried to address child undernutrition from multiple perspectives. With my mentor, Jerome Allison, what he encouraged us to think about is what makes the projects that we've been doing, especially in a global health environment, unique. We have now been working with our collaborating site in India for the past 10 years, and most of the energy behind that has come from students. We have had about 15 students now in School of Medicine from both UMass as well as the collaborating site in India, as well as in residency and fellowship, that have traveled back and forth. And so they have really brought the energy for the research projects that we have done. What ends up being unique about UMass is they're well supported by the faculty and really put in a position to succeed. So in fact, we created a model of this kind of trainee-led research initiatives and partnerships in an international setting, and that was published by USAID and was recognized by Consortium of Universities for Global Health in 2016. Even though my research was primarily focused on global health disparities, the training that I got prepared me well to be able to address health research questions overall.
I'm Jerome Allison, and I'm chair of the Department of Population and Quantitative Health Sciences. Apurva is, I would say, the best doctoral student I've ever worked with in my 30-year academic career. I used to teach a course called Social Determinants of Health, and the point of that was that the most important things that matter to you are not what we do to you as doctors, but your health is mainly determined by the conditions in which you live. And so after a lecture, Apurva just came in to my office and pitched some ideas, and I thought, wow, this student has really got it. And then in my experience as a mentor, I've learned that the most important thing I can do is identify folks with talent, work with them just a little bit to get them to surface and refine their own ideas, then give them the resources and let them go. And that's what happened with Apurva. One of the things that often happens is we do research and it gets written up in a journal and nothing becomes of it. But his research combines scientific excellence. It focuses on health equity. Both are passions of mine, but really is geared towards making a difference in underserved populations and making a difference in the clinical care of patients. I am very proud of his work. It's of the most highest scientific quality. One of the things that he mentioned is mentorship, and as other MD PhD students will learn, when you write a paper or you write a grant, you just don't do it once and it's over with. Apurva really went the extra mile to get input and to produce amazing products. And as an example, his dissertation was funded by an F award, and it's one of the few I've seen that got a very perfect score from the NIH. And when the critiques came back, they said there's nothing to improve on the project. So that sort of describes the quality of his work.
My name is Lael Gangmini. I am a second-year medical student. I'm part of the Clinical and Population Health Research program. Currently, I'm looking into health disparities and pregnancy, birth. That's what really excites me. In school, when I'm even in the MD program, when I'm in school and we're learning about birth and all those things, that's what gets me excited. And I'm an immigrant to the United States, and so things that have to do with immigrant population or Black people specifically. I'm a Black woman, or anything with race and gender. That's really what my interest is. So part of the summer I spent looking into teenage pregnancy in the U.S. Last summer I was in hospitals trying to consent women into a study. I worked with these researchers who had created a screener for mental illnesses in pregnant women. And so I was actually able to talk to women, before I even started medical school here with UMass, I was in the hospitals talking to women and asking them, are you willing to participate in this study? And I actually got to listen in to the survey that took place for the study. And another thing that I'm doing this summer is I'm working with another PI, and I'm getting trained on how to do research, how to do qualitative research. And I get to read her papers and have a conversation and figure out, as you are doing this, how do you get from having a question, having an idea, to structuring your surveys, your research paper, and working in teams to finally get a publication. So this summer I've been able to walk through the process, and hopefully as the school year goes on, I'll be able to continue working with her to eventually write my own paper and get involved in this kind of work. So it's been very, very exciting. The community here, that's actually why I came to UMass. If you're looking for good science, great science, we have that. But for me, it wasn't just being able to progress in research and really, learn medicine well. It was feeling comfortable and feeling, wanted and welcome. And that's what I felt here. When I came for my interview and during second look day, you ask the students, why did you come? And everyone says the community. Everyone is so supportive, and that's what I heard from everyone. And it sounds crazy and it sounds cliche, but when I came, I said, you're right. This is why everyone says it, because it's true.
My name is Kristen Maddox, and I'm in the Department of Population and Quantitative Health Sciences. I am generally a women's health researcher. I'm also a VA. I work at the Department of Veterans Affairs, and so nearly all of my research is on some aspect of veterans health. Because I am a women's health researcher, a majority of that is focused on women's health and specifically pregnancy among women veterans. Every once in a while there's a student that comes around, like my current wonderful student, who is very interested in women's health. And this is very important because one of the things that we've talked about quite a bit is the importance of having trained providers in VA who know how to take care of women veterans. And again, this goes back to women being such a small group of veterans in the VA. So the more that I can, train and educate young people to become interested in VA careers and become interested specifically in women veterans, we're really doing a great benefit for veterans all across the country. So that's why partnerships like this are important to students, but they're also important to us in the VA as well.